The European CDC has actually been very active in the role of addressing the issue of healthcare infections in long-term care facilities over the last several years, and have now conducted 3 prevalence surveys where essentially they worked with many different countries across the European Union and nursing home facilities within those countries to do work to assess what is the prevalence of infections on a given day in nursing homes across Europe. And based on using that data from the prevalence of a single day, they then created a model which allowed them to extrapolate if this is the given experience on any given day in European nursing homes, what does that look like when we translate it to the number of infections that occur over the course of a year. So we essentially evaluated the approach that they used and applied some available information from the United States to try and understand how that model might perform using our data. Now, of course, the data that we're using from the United States is very preliminary. We did a small-scale nursing home prevalence survey pilot a couple of years ago, so we were able to get an estimate of the prevalence of infections on a given day in nursing homes. It came from 9 nursing home facilities, about 12,000 nursing home residents, so not a very big sample. And we actually applied some other information that's available from the Centers for Medicare and Medicaid Services to plug into the model and understand what type of estimates we might be getting and what some of the limitations of the approach that the ECDC used.